following information is presented for discussion and educational purposes only and is not intended or provided as treatment information for any specific person or behavior. If you or a loved one is having behavioral difficulties, you are encouraged to seek professional consultation as soon as possible. Ladies and gentlemen, welcome to episode 8 of Ask the Behavior Doctors. I hope everyone had a wonderful holiday. We're here today. We have a couple questions from our parents. Remember, our goal here at Ask the Behavior Doctors is to be your experts, be your source of information, and answer any questions, concerns, curiosities that our audience has. We really want to be the go-to source for behavioral science info for parents, professionals, anybody that works in the pediatric world. So our first question today comes from parents. It says, what can I do to help my children behave better in public places, especially in like restaurants? I feel like they're so disruptive. I feel like they are so, scatterbrained. They move all over the place. They don't follow directions really well. I feel like it's disruptive to have them at dinner. How can I help my children behave better in public places, especially in public restaurants? So I wanted to prepare a thoughtful answer for parents, give them a solid plan of what to do. Number one thing I think parents miss out on is, I'll ask them, even with a young child, you should be able to ask them, do you know what's expected of you? Do you know the behavior you're supposed to do at a restaurant? And this seems incredibly simple, but many, many times when I've asked my patients' children, 2, 3, 4-year-old children, do you know the behavior that mommy wants you to do at the restaurant or the behavior that daddy wants you to do? And they'll say no, or I don't know. So parents, number one, you have to specify exactly the behavior you want from your kids when you're out in public. So that could be as simple as, I want you to stay in your seat. I want you to keep your hands to yourself. And I want you to only talk when mom or dad talk to you first, or only talk when we're not talking. So you can set just simple rules. The rules need to be simple enough that your child needs to be able to repeat them back to you. And you should have few enough rules that they're easy enough to enforce and keep track of. The second thing that parents often kind of forget about is I tell them, I say, does your child ever sit down at a table and appropriately eat? If not, then you expecting the first time they do that to be in a public restaurant is silly. Parents, you have to practice this skill, just like any other skill. If your child never does it, they're not all of a sudden going to be able to pick it up and do it at a random time. So parents, again, if they can't sit at a table at home, sit in their chair, use their utensils appropriately, eat with their utensils, wipe their hands with a napkin, do all of the basic little behaviors we expect in a restaurant. If they can't do that at home, they're not all of a sudden going to do it out in public. So I tell parents, practice the skill before you go out in public. Make sure they can do it reliably and consistently at home before you're going to expect that type of behavior out in a restaurant. Now again, is that behavior required in a restaurant? No. It's just some parents come to me with very high standards of behavior that they expect their kid to give them. And so I want to create a realistic expectation that parents, what your child typically does at home will probably be most likely to transfer and generalize out to the restaurant world. So again, train and teach the behavior you expect at home before you expect it out in public. Parents, I want you to praise and reinforce the behaviors you're looking for when you are out in public at dinner. I want you to notice the little things that your kid's doing. You can say, hey, buddy, you're sitting so nicely. Oh my gosh, you're being such a quiet little guy. Hey, you're using a really nice volume. Your tone of voice, you're talking at the perfect volume. You're keeping your hands all to yourself. Oh my gosh, buddy, you're coloring that picture so nicely. You want to praise and reinforce these behaviors consistently, especially the younger your child is, and especially the earlier in this process you're trying to train your children to be appropriate in public. The reason is again, you're going to get the behaviors you consistently reinforce. By attending to these behaviors, you make these behaviors more important. You also make your child more mindful of these behaviors when you offer really specific praise about those behaviors. Bring appropriate activities. So again, we go back to some parents expect their children to sit there like stone statues and not talk and not move at all. And I ask parents, do they ever do that anywhere else? Do they ever do that at home? And parents will say, no, not really. So then I'll say, then why would we expect them to all of a sudden do it when they're out in public? So parents, little kids move, little kids talk, little kids fidget. That's just what they do. So if you want to bring things that can get their attention or that can keep them entertained, I recommend planning for that ahead. Bring appropriate activities. You don't have to bring screens if you don't want to. I've obviously talked about screen time on here before. You can allow them to use screens if you're comfortable with that, but it doesn't have to be screens. It can be coloring sheets. It can be an Etch-a-Sketch. It could be drawing materials. It could be puzzles that you bring for your kid. My recommendation for the things that you bring is make sure they're not disruptive, make sure they are appropriate for the environment, and make sure that there's something you can bring to multiple types of places. So certainly don't bring loud toys, loud obnoxious things with lots of lights or lots of moving parts that would probably disrupt other people out in that public place. I recommend bringing at least 5 items with you. I recommend rotating those items, and I definitely recommend not allowing those items to just sit out on the table. Only allow your child to have access to one item at a time. Again, parents, going back to that practice concept, if they have a problem with that, if you can't remove items from them, if you can't have things put away and they throw a big fit or whatever, you need to work on that skill at home before expecting that out in public. Okay? Predict your child's needs and requests before they come up. You can prevent most problem behavior from occurring if you know your child's routine, if you have a plan in place, if you convey that plan to your child effectively. So, sitting down at the table, you know that your child's probably going to want to play with the utensils there. So you may move the utensils away from them. You may give your child immediately a snack to start eating so that they're a little bit more focused. You can immediately give them maybe a small puzzle or drawing utensils that they can start to draw with so that they don't get restless. My point is, be observant, be respondent. Predict what your child's going to ask for and what they're going to need before they do it. So when the food gets delivered, perhaps you can immediately cut it up. And then what I like to tell parents is maybe get a side plate and put only the bites you expect your child to take on that plate at that time. Remember, parents, you want to present the amount of food to your child that you expect them to eat. Sometimes a kid's plate or any kind of dinner they prepare can have a large amount of food that your child may not even know what to start with. They may not know where to start. Like, what do I eat first? The mashed potatoes, the green beans, or the chicken? I don't know. So my recommendation is parents, maybe cut it up in small pieces or put small portions on a small side plate and tell your child, hey, when you eat this, then I'll let you have access to your toy that you want. Or when you eat at least 5 bites of this, that's when you can have this item that you really want. Again, by doing that, by predicting their needs and being responsive to them, what you do is you prevent them from needing to ask questions, you prevent them from needing to be disruptive, you prevent them from needing to use their behavior, perhaps inappropriately, to communicate what they want. So parents, be respondent, be proactive, know what they're going to need and give it to them before they even need to ask. The best thing, there's even one thing better than this, is to train your child to be completely independent. If you have a 3, 4, 4-year-old or 5-year-old child, most of those children should be able to use utensils, cut up their own types of food, dispense their own bites. The best thing you can do as a parent is transfer control of those mealtime behaviors to your child as quickly as possible. Again, going back to that concept of practice at home, parents, if you're doing a good job training and prepping your child to have those transferable, appropriate behaviors at mealtime, then they're going to be able to eat meals at a lot more places, in a lot more settings. And that behavior is going to be a lot more likely to generalize. Know your child. If they're overly active, if your child requires an excessive amount of physical output activities, Know your child and prepare before you go to the meal. Go to the park, go swimming, go do something physical for several hours before. Make sure your child is motivated to sit quietly. The best way to make sure someone's motivated to sit still is to have them exert that energy before they go out. Also, too, when bringing your child out in public to restaurants, you need to make sure that they're hungry. So what I mean is, you want that child to engage in appropriate mealtime behaviors. Appropriate mealtime behaviors is sitting there eating the food that you're there to eat. So a lot of parents will make the mistake of allowing their child to snack too frequently, or allowing their child to eat and fill up before they go to dinner. Well, what happens is parents are hungry, everybody else is hungry, but the child's not because they've already eaten. So parents, you want to make sure that you have your child motivated to sit quietly, sit still, and motivated to eat the food that you buy them, or eat the food that you present to them at that mealtime. So it just involves a little bit of preparation, a little bit of planning before you go out to that restaurant. I also recommend parents look at the menu before you go to the restaurant. Don't let that be the first time you've looked at that menu when you show up. If your child especially has any type of food allergies, any type of exceptionally picky eating, if you go and you don't plan accordingly and you didn't look at that menu and you're surprised in a bad way, well, then your child could have a major blow up, a major fit. Could say, I don't like any of this type of food, Mom. I'm not hungry. I don't want any of it. None of it tastes good. So parents, I want you to plan. I want you to look at the menu. And if you're going to a place maybe that you or your partner really like, but that your child may not like, consider bringing alternative food items that your child will like. You can also use a pairing procedure at the dinner. So let's say there are a couple like snacks that your child especially loves, and you know that if you bring these snacks, your child will absolutely want to eat them. Well, what you could do is you could pair taking bites with the food at the restaurant with having bites of their very favorite food that you brought in a baggie with you. So parents, bring tools with you. Prepare, look at the menu before you go, and make sure that if you're uncertain about whether or not your child's going to like that food at that restaurant, make sure that you bring something they love so that you can have that in your back pocket just in case you need it. Include your child in the conversation and interaction at dinner. Remember, we're trying to train young people here. We're trying to teach them how to engage in the social event of eating a meal in public. That's an important skill that they're probably going to utilize the rest of their life. So parents, we want to start to train that skill of being included, being engaged, being interactive with all of the other people at dinner. So my advice to you is to include your child in healthy ways in conversation at dinner. Include discussion about things they're interested in. Seat them by people you think they're likely to have something in common with. Do your best to shape those good behaviors. Also, too, by giving attention preemptively, it's basically called non-contingent reinforcement. By giving that attention preemptively, you make your child not need to engage in naughty behaviors to get attention inappropriately. So if you're giving lots of good quality attention and tending to those good behaviors that your child's given you, they won't need to engage in naughty behaviors to get that behavior inappropriately. So again, a lot of good reasons to include your child conversationally. If your child's not old enough to maintain conversation or do anything like that, that's okay. Stimulate your child with appropriate activities and just start shaping the behaviors they're capable of giving you. Even if that includes something as basic as just sitting still, sitting nicely with your hands to yourself, and staying in your seat. Those are all great behaviors that they're going to need in the future. Next parent question comes about seeking services. I get calls many, many times from parents that basically say, Dr. Jake, my kid is engaging in just outrageous behaviors. They've been getting worse, and I'm really concerned about my child. I mean, as a matter of fact, Doc, they're so bad that I think my child may need inpatient placement for these behaviors. So a lot of parents will ask me, how do I know? How do I know what level of care? How do I know where to start when finding services for my child? What do I do? Who do I contact? What do I ask? What's the right thing to say? So I wanted to discuss this topic and give parents some things to really look for. So number one thing you should do, you got to seek professional consultation. Seek a behavior professional, master's level, doctoral level. I'm a board certified behavior analyst. There's a website called the BACB.com, so BACB.com stands for Behavior Analyst Certification Board.com. Look there. They have a tab called Find a Certificate. Look in your state. Look for the closest local providers. You can look on Google. You can contact your insurance provider. Ask them for credentialed behavior specialists who are in network. My advice is to get to a professional quickly. The reason is a professional can help you navigate this process. It's too overwhelming early on, especially if you've never navigated it, to know exactly the right things to say, the right things to do. A professional can help you navigate this process a lot more efficiently because this is what they do all day, every day. So some of the very first things I ask my parents on the phone after they tell me this, that they think their child is so severe they might require inpatient placement. I ask them if there are any behaviors that reach what's called DTS or DTO criteria. So that means danger to self or danger to others. So I ask parents, is your child engaging in behaviors that literally are putting themselves or other people in danger? Are they engaging in severe self-injurious behavior? Are they engaging in property destruction? Are they trying to attack people with weapons? Are they threatening to hurt themselves or others? Are they getting injured as a result of their behaviors? All of these things, so danger to self, danger to others. And so what I ask parents is, is your child directly and legitimately a danger to themselves? Are they presenting a danger to themselves, or are they presenting a danger immediately to others? This is an important question because it's one of the first questions an insurance company is going to inquire about. Are there any behaviors that meet what's called DTS, DTO criteria? So behaviors that meet that are assaultive behaviors, self-injurious behaviors, severe property destruction, anything that would cause a hospital visit, severe bodily injury, anything that basically would get a person arrested, put into the hospital, or would immediately damage, injure, or hurt someone else probably is going to qualify for danger to self, danger to other behaviors. So when I ask this question, a lot of parents will think, well, my child has never actually hurt themselves. They've threatened it, but they haven't done it. And they'll think, well, no, he can be around his brother for about 3 or 4 hours without causing any harm to him. I would probably estimate that about 10 to 20% of the cases that call me have criteria that meet danger to self, danger to others. So that means about 80% to 90% do not. So then, if they don't meet that danger to self, danger to other criterias, the next place that they're probably going to qualify would be more of an outpatient type of treatment. Now, outpatient treatment can range wildly in the level of care, the quality of care, and the amount of care. Here at our clinic, we have patients that we do brief consultation with. I'll do consultation with parents just intermittently, maybe 1 hour a month, 3 hours a month. We have comprehensive cases that receive minimum 10 hours of treatment a week. We also have some cases that get almost 50 hours of support a week. I have been involved with cases where insurance has approved someone round the clock to be with a person because they qualified for this danger to self, danger to other type of behaviors. So parents, you can range all the way from 0 up to 120 hours a week of support and care, even with outpatient services. So just because something's outpatient or inpatient doesn't necessarily going to mean it's less intense. Inpatient is meant for the most severe, for the most immediately serious type of behavioral concerns. And most inpatient units see their primary task as getting the child stable enough to be released to a less restrictive environment, back to their natural environment. So they'll stabilize the child, but it's not necessarily treatment per se, especially in behavioral health. Many inpatient units will not keep children, past 2 weeks to maybe at most 30 days. And certainly children with severe behavioral issues, they're never going to be fixed in 30 days. So even that initial inpatient placement will typically result quickly in the need for outpatient services. Also, too, insurance is going to ask, and I say insurance, if you can afford inpatient psychiatric treatment out of pocket, congratulations. I mean, that's great. Good for you. It's very, very expensive. It's very costly. Minimum $100,000 to $200,000 a year for intensive behavioral treatment. So most people would need to utilize insurance benefits. So that's why I keep mentioning insurance. So insurance would ask about something. So if it's not danger to self, danger to other, the next level of criteria they would ask for is like medical necessity. So medical necessity means, is it medically necessary that this child receive this treatment? And there's two parts to that question. So will the child benefit from this type of treatment? And number two, without this treatment, will the child's symptoms worsen in intensity, frequency, or duration? Okay. So as a doctor trying to show medical necessity for the treatment, we've got to show both sides of that. So when I'm talking to patients, I'll often ask, okay, so your child doesn't maybe meet necessarily danger to self, danger to other criteria, but what other types of treatment has your child received recently? Many parents will tell me it's just about counseling or, hour-a-week therapy, play therapy, things like that. So you have to figure out what kind of treatment level has the child been receiving? Has that treatment level been successful or not? And if not, would a more intense level of treatment be necessary? Okay. So oftentimes, again, as a professional, when parents bring children into me, we'll provide that assessment pretty quickly, and we'll be able to get a read about the frequency, intensity, and duration of those symptoms and see if they are truly worsening over time. So insurance companies are going to need to have that medical necessity for the treatment documented. Again, they're probably going to need to show that lower levels of care have been unsuccessful. They're going to need to see that the child's symptoms are worsening in frequency, intensity, and duration. And they're going to need to see that a higher level of care will have a more intensive plan to address those behaviors. A comprehensive plan, again, is going to identify target behaviors. A comprehensive plan is going to identify the function of the behavior. A comprehensive plan is going to be written, very prescriptive. It's going to have prevention strategies. It's going to have behavior change strategies. It's going to have consequence strategies. And then it's going to have program monitoring strategies that when the child's behaviors are better, who's going to measure and maintain and monitor, continue to monitor this child's progress. So that's what a good plan is going to have in place. So again, parents, my number one recommendation, if you are concerned about navigating this process or concerned about what level of care your child needs, consult a professional as quickly as possible. Let them help you navigate this process. Really ask yourself, are my child's behaviors dangerous to themselves or to others? If you do feel like they're consistently meeting that criteria, contact someone immediately. And then the other thing is obviously medical necessity. Parents, ask yourself, do I feel like lower levels of care have been unsuccessful? Do I feel like my child's making progress with their current level of care? And if not, do I think a more intensive form of treatment would make a better difference, with my child? So those are all going to be important questions to ask yourself. So, ladies and gentlemen, that brings us up to the end for today. We want you to please, please, please continue to submit those questions to us at info@scottsdalepbs.com. We want to thank our photographer, Mr. Philip Carnevale of philipcarnevalephotography.com. We want to obviously thank you again for submitting your questions and joining us here at Scottsdale Pediatric Behavioral Services and Ask the Behavior Doctors.